Hi, my name is Kylie. I'm going to be performing my head to toe assessment today. I have on the appropriate uniform and all my equipment out in front of me. Hi, my name is Kylie. I'm going to be your nurse today. Can you tell me what brings you in? The cheer physical. Okay. I'm going to start by washing my hands and pull the curtain shut for my privacy. Can you tell me your name and your date of birth?
Bethany Gordon, 8/11/03.
Can you tell me today's date?
9/30/24.
Okay, the patient verified the date of birth, their name, and the date. Okay, so today we're going to be doing a head to toe assessment. Is that okay with you?
Yes, it is.
Okay, so first we're going to start out by checking out her body appearance and her movement and hygiene. So we're going to check out her skin, feel the warmth. Okay, so she appears well groomed and dressed for the season. Can you tell me where you're at today?
The clinic.
Okay, patient is oriented ×4. She's calm and cooperative. Can you tell me what you had for breakfast?
A protein bar.
Okay, and who is the current president?
Joe Biden.
Okay, so her recent and remote memory is intact. So now I'm going to check the skin color and quality. Okay, her skin is pink, it's warm to the touch, and the hair distribution is equal. Next, I'm going to check her face. Her face in school. Her face is symmetric, and her school, the shape is all normal. Can you open your mouth for me? And can you smile? Okay, her voluntary movement is intact. Do you know the importance of a sports physical?
Yes, to make sure I'm healthy and can play in my sport.
Correct. Okay, the patient seems to be calm and cooperative, and her speech is clear and well articulated. Now for her judgment, can you put your finger to your nose? Okay, and can you put both of your fingers to your ears? Okay, so her judgment is appropriate. Now I'm going to inspect her nail beds.
Her scalp and her
Okay, her capillary refill is 2, and she doesn't have any deformities or any clubbed fingers. Okay, now we're going to be moving to the Snellen chart to test her vision. She's standing 20 feet away. Alright, can you cover up your right eye for me? And she has her glasses on, so we're going to be using her glasses for this. Okay, can you read the first line for me?
E,
Second,
FP,
third,
TOZ,
fourth,
LPED,
fifth,
PECFG,
sixth,
EDFCZP.
seventh.
I can't read that.
Okay, so her vision is 20/30 for her left eye. Now I need you to cover up your left eye. Okay, start at the top again.
E, FP, TOZ, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC, LEFOGPCT. I can't read that one.
Okay, so for her right eye, it is 2015. I'm gonna go ahead and put my gloves on, and then we're gonna start at the top of that table. So we're gonna go ahead and start palpating your scalp. Okay, I'm just gonna feel for any lesions, look for any lesions, feel for any lumps or masses. Did you have any tenderness as I was doing that? Okay, now we're gonna check cranial nerve 7, which is the facial nerve. So can you puff out your cheeks for me? Okay, can you lift your eyebrows? And can you close your eyes? Okay, good. So that means that cranial 7 is intact because you can move both sides of your face. Okay, now cranial nerve 5 is with the trigeminal. So can you open and close your jaw?
Yes, that's correct.
Okay.
The cranial nerve
And then just move down your temples.
Now I'm just gonna have it take a look at your lips.
Okay. That means that cranial nerve 5 is intact because there's no popping in your jaw. Now I'm going to test the sensation on your forehead. So close your eyes and let me know when you can feel this. Okay? So she has the sensation on her forehead. Now I'm going to palpate for her sinuses. Let me know if you feel any tenderness. Okay, so she has no sinus tenderness present. Now we're going to test your confrontation. So cover up this eye. Okay. So let me know when you can see my finger.
So I'm just gonna get you.
Okay, now cover up this eye. Let me know the same thing. Okay, so her peripheral vision is intact. Now cranial nerve 4 and 6. Now we're going to perform the cranial nerve 8 test, which is the whisper voice test. So I'm just going to cover up this ear and whisper, and you tell me what you hear. 1,
1, 2,
okay, same on this side.
3, 4.
Okay, so cranial nerve 8 is intact. Okay, now I'm just going to inspect your nose. So can you raise up your head for me? Okay, the color is pink and the shape is symmetrical. There's no drainage or anything. And is there any tenderness when I touch it? Okay, and now we're going to check cranial nerve 1, which is olfactory. So I'm going to go ahead and open up this. Okay, so close your eyes. And I'm going to ask you what you smell. Okay, so good. So that means cranial nerve 1 is intact because you can smell the alcohol pad in both nostrils. Now I'm going to inspect your tongue and your mouth. So open your mouth for me. Okay. There's no lesions or dryness, and your mouth is moist and pink. So now we're going to check your tongue movement. Can you stick out your tongue and move side to side? Okay, that is cranial nerve 12, so that is intact because you can move your tongue. Now we're going to check the buccal membranes and your gums.
Hi, my name is Martin Wachowski, and this
Okay,
is my
there's no bleeding.
assessment video.
Your gums are pink and moist. There's no
That's in
lesions.
great uniform.
Now we're going to inspect your
Over
teeth.
here, I've got my equipment, and so now I'm going to go ahead and knock.
There's no missing teeth or broken. Now we're going to inspect cranial nerve 9 and 10, which is the movement of the uvula, and the soft palate and gag reflex. Close your mouth. Now open wide. Okay, so her uvula goes up, so that means that is intact. Now I'm going to look at the soft palate, which is on the roof of her mouth.
You go ahead and verify your name and date of
Okay,
birth.
and then I'm going to get a tongue blade to check her gag reflex.
Got that done. So today I'm going to grab one of
Okay,
those.
so open.
Okay, so I'm just going to run it down for you real quick. So basically, we're going to start up in your head.
Okay.
Make sure everything's
Her gag reflex is intact, so that means 9 and 10 are both intact. So now I'm just going to inspect her neck. Okay. Everything looks symmetrical and aligned. Okay. Now can you move your head from side to side for me? Okay. And then up and down. And then just all around. Okay, good. Can you move your shoulders up and down? Okay, now I'm going to inspect your thyroid. Okay, can you swallow for me? Okay. Now I'm going to palpate all of your lymph nodes. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Did you experience any tenderness with that? Okay, now I'm going to palpate the carotid artery on both sides, but not at the same time. Okay. Okay. I'm going to listen to it with the bell. Can you hold your breath for me? Okay. Okay, sounds good. So now I'm going to check for cranial nerve number 11. So can you move your head side to side? Okay, and then up and down. Okay, and then all around. Okay, so cranial nerve 11 is intact. And can you turn around for me? So I can inspect your back. Okay, so I'm just going to inspect your back, the spine, make sure it's symmetric. Everything looks symmetric. Okay, and then I'm going to do the 99 test. So when I place my hands on your back, say 99 every time I move down.
99, 99, 99, 99.
Okay, so the vibrations are all equal. Now I'm going to do the expansion test. So take a deep breath. Okay. 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 So my hands expanded equally, so she passed the expansion test. Now I'm going to listen to the lung sounds on her back with the diaphragm.
Wait, where are you standing? We did it over here.
You want me to do it right there?
Stay right here. And then she turned, or I turned, and I had the foot.
That makes no sense, but okay.
So you have to look in here, and then.
Well, I'm moving the, if she's having the book over her shoulder, would you not be able to see
No.
the book over her shoulder?
Like this.
Just going to lift this up.
Okay, so I'll break mine, I'll do posterior, then I'll do anterior. That's exactly what I did.
So, you're not doing any of this one? Wait, I wouldn't have this one. You didn't have this one. Cause this is also.
Okay. All the lung sounds sound normal. So now I'm going to check for CVA tenderness. You let me know if you feel any tenderness. Okay, one more. Okay. So now can you turn around for me? And then pull down your gown. Okay, now I'm going to check for symmetry of the chest. Everything looks symmetric. And I already know that her chest expansion is normal by her respirations. So now I'm going to listen to the lung sounds on the front.
Jump in center full. There's salivation for me.
Oh, for what? Long sounds? Well, we just put it in and out, like each time. Alright, I think we can see that. Is there any stuff?
Alright, let's do it. Yeah, right, so now I'll be listening to the,
Okay, and can you lift up for me?
See that so bad.
um,
Oh. It's okay, you don't need it, I mean, it's just the bones, crackles. Yeah. Wrong
you
guy.
can't see it over there.
Okay. So I checked her anterior lung sounds. Okay, and now I'm going to inspect your arms. So can you lift your arms up for me?
So I'll be listening.
Okay, I'm just going to feel the temperature.
Right, so next I'll be listening.
Okay, skin is warm. Okay, and then she has no tremors and no contractures, and obviously she does not have paralysis or muscle weakness if she can move her arms up and down, and there's no swelling. And was there any tenderness when I did that? Okay, now I'm just going to palpate her muscles.
Out.
Let me know if there's any tenderness. Any tenderness? Okay. Now I'm going to palpate her radial and her brachial pulse on both arms. So here's the radial. Okay, palpable. And then the brachial is palpable. Okay, so they're all palpable. And now I'm going to test your range of motion. So can you lift your arms up for me and move them out? Now rotate your wrist and then lift up your shoulders. Okay, so now we're going to do the strength. So can you grab my fingers? Okay, and can you push up against my hands?
Heard no crackles, no wheezing.
And then pull up against my hands.
Next I'll be testing your
Okay.
tenderness.
And then you're going to put out your arms and try to lift your arms up. Okay, and now push down.
That's on here.
Okay, and now
Did y'all
you
see where I
lift your
messed up the
shoulders.
positioning of the stethoscope?
Okay. Now I have my patient in the supine position. She's sitting at a 45-degree angle. So I'm just going to check her jugular vein for any bulging or pulsation or distension that I can see. So can you lean back? Okay. I don't see her jugular veins, but if I did, that would mean that she could possibly have an aortic aneurysm, so it's good that they're not present. Okay, now we're going to listen to the S1, S2 sounds, all 5 areas with the diaphragm and the belly.
No problems with the nose there.
Pulmonary.
No abnormal findings. You can't
The
flare your
urge.
nostrils.
Tricuspid. And then the mutual. Okay, and then we're going to do the same thing with the
I
bale.
don't see any drainage at all, so you have no redness, no lesions, you don't have to put that you can feel. I didn't see it. Okay. Now we're gonna do the olfactory cranial nerve. So I'm going to.
Tricuspid.
You just close your eyes.
I was waiting for the second one.
And then the mutual bale.
I'm slow.
Now I'm going to inspect the abdomen, so I'm going to lay my patient flat.
Within our reach.
So is it okay if I raise it here? So I'm just going to inspect the patient's abdomen for looking at the contour and the symmetry and noticing if there's any lesions. Everything looks symmetric and contoured. There's no lesions present. Now I'm going to listen to bowel sounds in all 4 quadrants, starting with the right lower quadrant with my diaphragm.
I'm gonna go ahead and use my
That's how that she has full range of motion of her upper extremities.
Okay. Everything seems to be in set. Mother's good. No lesions. Any irritation with your mouth. No drainage. Nothing like that. Okay. Did you
Okay,
have your
so the bowel sounds are present. I'm going to perform light palpation and then deep palpation just to see if there's any masses or any tenderness. So let me know if there's any tenderness.
Oh, that's the way.
Okay, and then deep palpations.
We're doing tongue on the next one, so on the back of the okay. So we'll just either move or
So there was no masses or any tenderness. She isn't guarding or has any pain, and she would have rebound tenderness if I pressed in, and then when I let off, she was in pain. So she doesn't have any rebound tenderness. Okay, now I'm going to pull this down. Alright, now I'm going to inspect her legs. The color is even, no abnormal color, no perfusion. The temperature is warm. Okay, then I'm just going to take off her sock to check the capillary refill. Okay, and she has toenail polish on, but I would press and see how long the capillary refill takes. Put the sock back on. Okay, I don't notice any deformities, no swelling or any tenderness. There's no lesions. And now I'm going to palpate the muscles. I'm just going to start on this leg.
Preferably twice a day. Go to the dentist. Normal checkup once or twice a year.
Let me know if you feel any tenderness. Okay, there's no spasticity or edema in the legs. She has no tenderness and there's no tremors present. So now I'm going to palpate her arteries. So first we're going to do the dorsalis pedis. So I'm just going to pull this down. It's the top of the foot. Okay, that one's palpable. Pull this back up. Okay, and then I'm going to do the tibial. Okay, that one's palpable. And then can you lift up your leg for me? Okay, then we're going to do the popliteal, which is behind the knee. Okay, palpable. And then femoral is right here. Okay, palpable. So all 4 of those are present. And now we're going to do the range of motion and strength test. So can you lift this leg for me? Okay, and then bend it with your knee going towards you. Okay, do the same thing with the other leg. Lift up and then towards you. Okay, and then Can you rotate your ankles for me?
At the same time.
Okay, good job. And then press up against my foot like you're pressing on a gas pedal.
What if you like put your hands like this?
Okay, and then lift this leg. Okay, can you try to push down?
Oh, it's
Guys,
Okay, and then try to push up. Same thing with this one. Okay, up. Okay, and then we've already tested hips and knees. Now I have my patient sitting on the side of the bed with her legs dangling. And now we're going to test her cerebellar functions. So first we're going to start with the upper extremities. Can you put your finger to your nose? Okay. Now we're going to go down to the lower extremities. Can you run your heel down your opposite leg? Okay, can you do it with the other foot? Okay, good job. So those are intact, and now we're going to test her reflexes. Bilaterally, we're going to do with a reflex hammer. I have my reflex hammer, and we're going to start at the knee. Okay, bilaterally. Okay, good job. Now we're going to do the biceps. Now we're going to do the triceps, so arm like this.
I was thinking this
Okay, other arm. Okay. Now we're going to do the brachioradialis.
and
Right for this next session, I'm gonna have to put your finger to your nose.
would it be easier if I was
Now we're going to be doing the Achilles.
We'll do knee.
or you can start
Okay, now I'm going to check her Babinski reflex, so I'm just going to take her saw. I'm going to draw a J on the bottom of her foot. Okay, so her test is negative. If it was positive, that would mean her toes would have fanned out, and that would be because of central nerve damage. Okay, so those are all the reflexes. They're all intact. Now we're going to be doing sensory perception. So can you close your eyes for me and hold out your arms? This is the sharp and dual test. So I'm going to break this in half. Okay, and then she'll tell me if something is sharp or dull. So you just tell me what you think it is. Soft. Soft. Dull. Sharp. Sharp. So she has her sensory perception intact. Now I'm going to get my patient to stand up. And I'm going to assess her gait. So I'm going to stand behind you. You just walk forward and then turn around and walk back to me. Okay, there's no abnormalities in her gait. Okay, now can you stand on one leg for me? Okay, put that one down and stand on the other one. Okay, so her balance is good. Now we're going to assess her motor skills, which is the Romberg test. So I'm going to get her to close her eyes. Okay, there is no swaying. Now I'm going to check your spine, so can you turn around and touch your toes? Spine is symmetrical. You can stand back up. And now we're going to test the range of motion of the spine. So I'm going to get you to twist your hips.
I'm going to start with the bathroom. I was like, she doesn't have a quick eye.
Okay, and that is the last test for this head to toe assessment.